today I'm going to do my video on IV fluid and medication administration. First, before entering the patient's room, I'm going to gather my supplies, which include my fluid and my medication, as well as, let's see, my primary tubing and my secondary tubing. Next, I'm going to verify my order. My order is for fluid 150 ml over 60 minutes at 15 drops per ml. That gives me 37.5. We're going to round it up to 38 drops per minute. Next, for my amoxicillin, it's 100 ml over 15 minutes, 15 drops per ml. Gives me 100 drops per minute. Now I'm going to enter the patient's room, perform hand hygiene, put on gloves. I'm going to verify the patient's name with 2 identifiers and date of birth. I'm going to ask the patient if they have any allergies, and they do not. I am going to do my 6 rights, which include right patient, right dose, right route, right time, right medication, and right documentation. So I'm going to gather my supplies. I'm going to open my tubing. Okay, my primary tubing consists of my spike, the drip chamber, the roller clamp, which I ensure that it's in the off position. Next, we're going to, part of our tubing is the Y adapter, which is used for medication administration, and then the adapter end. Okay. Now I'm going to take my fluids, and to spike it, I'm going to take this cap off. I'm going to take this cap off. I'm going to spike the bag. Make sure it's pushed all the way down. You want to hang this 30 inches above the patient. And let's see. I'm going to fill my drip chamber to half. Perfect. I ensured that my roller clamp is in the off position. I'm going to hang the bag, like I said, 30 inches above the patient. Okay. Drip chamber's there. Now we're going to prime the tubing. Okay, to prime the tubing, you're gonna roll the roller clamp up just a little bit, and then you'll get a couple drops in the trash can, and you can then turn it off. All right, there's a couple drops. Let's see, I see an air bubble. Okay, I'll get that air bubble out. Perfect. Okay. So, like we said, for fluid, it's gonna be 38 GGTs per minute, drops per minute. Can't find my watch, so I'm just gonna use the phone, and I'm gonna count 38 drops per minute. I'm going to use the roller clamp to adjust the drops. And I'm going to put this in. Now that I got 38 drops per minute, I am going to put it in the off position. I'm gonna set my tubing to the side. Let's see. Now I'm gonna do the same to the next. I'm going to ensure that I have the right medication. I'm gonna take my secondary tubing. The same thing with this one. I have my spike, my drip chamber, my roller clamp, in which I'm gonna put it in the off position, and my adaptive end. Let's see. There's my tubing. And on my medication, I ensured to date it with the patient, or patient's name, date, drug, amount, the day that it was added with the date, the expiration, and my initials. I'm gonna take this off, take the spike off, oops. And I'm gonna spike my tubing, push it all the way down. I'm going to fill my chamber to halfway. Okay. And then I'm going to hang my medication higher than the fluids. Okay. And then I'm going to take the cap off. And I'm going to take my previous, I'm going to prime my tubing first to ensure that there's no air bubbles. There it goes. Perfect. Now I'm going to clean my Y port with an alcohol swab, and then once I let it dry, I'm going to take the cap off. Let's see. Let me see one. Oh, there it goes. It's just a little push. Perfect. So now that they're connected, it's going to be 100 drops per minute, which again, I would prefer a watch. I am going to have this chamber dropping at 38, and then this one to be at 100 drops per minute. I'm going to start that now. Alrighty, so that has ran for a minute just for demonstration purposes, and now that everything is good, I would attach this to the patient and ensure that they're left in a comfortable position and that they are feeling okay. Educate the patient that if there's any redness or itching or swelling, to push their call light, and a nurse will come in and check on them. Thank you.